So thank you for being here today. I'm going to be handing over to Stan Papoulias and Kerr, who created, with other people as well, have created a development framework for public involvement workforce staff. And you'll hear more about that today. The session will be basically hearing about that framework, and then we'll move into breakout rooms where we can discuss the framework as well. I will hand over to Polly and Stan now.
Thanks, Mirat. And thanks everyone for your interest in this and for coming along. We're absolutely delighted that so many people are here today, slightly overwhelmed by it, but on the whole, really pleased. So I'm Polly Kerr. I am the Patient Public Involvement Manager at the Nuffield Department of Primary Care Health Sciences at the University of Oxford. And I'm here with Stan. I'll let you introduce yourself, Stan.
Hi everybody, so I'm Stan Papoulias. I am a lived experience researcher in mental health and also do research on patient public involvement, and I'm the lead for the patient public involvement research theme of the NIHR ARC Applied Research Collaboration South London. Really glad to be here today.
Thanks, Dan. So just a little bit of a timetable for today. We're going to start by giving you some background and context for how the framework came about, how we developed it, and have a bit of time for you to ask us any questions about that area of work. Then we're going to go into breakout sessions, and that's really going to be the sort of the bulk of this today. We really want to hear from you about your thoughts on the framework. I know the link did get sent out before. If you've had time to look at the framework before now, that's brilliant. If you haven't, I think Nikki was going to put the link in the chat so that you can have it in the background, because we'd really like to hear from you about your thoughts on it, and I'll speak more about what we're looking for in a minute. At the end of the breakout sessions, we'll just take a short 5-minute break for everyone to catch their breath. And then we'll take 2 minutes feedback from each group, just about your top points in the discussion. And then we'll wrap up and tell you about our plans and the next steps for this work. So that all sounds okay. So as a reminder, at the end of 2021, NIHR put out a call that was entitled Learning from and Strengthening Regional Infrastructure for Involvement, Engagement and Participation in Health and Care Research. And they offered up to £10,000 to answer the question, to what extent and how effectively does regional infrastructure for involvement, engagement and participation realise impact for research? So in Oxford and Thames Valley region, where I'm based, we got together lots of the PPI staff working in the different NIHR organisations, plus a researcher and a few public contributors. And we had a bit of discussion because we wanted to put in a proposal, and we talked about various things, different ideas, but a recent upsetting experience that a couple of the people in the group had been through in a PPI meeting got us to talking about difficult situations in PPI and the potential impact that they can have. So we know that most PPI is productive and valuable and done with all the best intentions, but it isn't without tricky situations such as poor behaviour, which was what the incident in question had been, lack of support, the challenges of doing things online, and the not insignificant admin burden that I think we can all relate to. And those are just to mention a few. So our proposal was to hold a workshop to capture the range of difficult situations that can come up from the different perspectives of people involved in PPI. So PPI staff, like us, researchers and public contributors, with the overall aim of prioritising support and developing resources so that we could be in a better place to address these issues in future. We were awarded the funding and then had to plan the workshop in a really short time frame. So we awarded the funding in January and had to spend it by the end of March. And that ironically threw up its very own difficult situation with one of our facilitators not feeling supported. So that in itself was a learning for us. So we liaised with colleagues at Manchester Centre for Primary Care who'd done a similar piece of work a few years ago, because we wanted to make sure that we weren't duplicating anything that they'd done, and we could rather build on that and plan our workshop accordingly. So the workshop itself brought together researchers, public contributors, and PPI staff with an even spread. We started the workshop setting the scene with some examples of tricky situations that had come up from the point of view of each of those three groups. And then we split into our sort of respective stakeholder areas to discuss different things that had come up, and also sort of importantly to start to think about troubleshooting those and ways that we could address them. We finished the afternoon with a group discussion and a democracy exercise to sort of establish priorities for work. And some key themes emerged from that, as you can see from the slide on there. Training was absolutely highlighted for everybody involved in public involvement, but we did feel that for researchers and public contributors, this is already actually happening quite well. There are lots of initiatives going on, but a real gap is any sort of training or career development for PPI staff. And it was a clear message from our workshop that PPI staff need to be well equipped and well supported in order to do their role effectively. And many of the researchers, and particularly the public contributors who came to that workshop, were really surprised to discover that there is no training, and that we go into this without any training for this role. So we submitted our funding, the report of the funding, and then we were invited by NIHR to outline a proposal for the next steps of how this work might look to pilot and evaluate something for NIHR, who also provided additional funding for this, for which we're very grateful. And it was at this point that we in Oxford got in touch with STAN, because we were aware of their work on the hidden labour of PPI. And we also talked extensively with Jo Welsman about the work that she'd been doing on the emotional labour of PPI, because we really wanted to bring that all together. So I'm going to hand over to Stan now for a bit to tell you a little bit about what we did.
Thank you, Polly. Yes, so when I came in, the survey was being created, and so the Oxford guys, with our support, created this survey, which we sent broadly to NIHR, to NIHR people working in PPI, but also beyond the NIHR. And it had three main questions, because we wanted to understand the skills and experience that people had, as well as the skills and experience that they felt they were lacking, and also where this kind of new workforce, as it were, new workforce was coming from. So we had three main questions, including a sort of any other comments question, but we also had a couple of other questions about how long people have been in the role, whether that was a full-time or a fractional role, and how it had been funded, whether to identify how many people were actually funded by the NIHR. In the end, 82 people responded, so that was quite a remarkable response. We were very pleased with this. We have to say that nothing that people said came as a shock. There was a lot of consistency across different responses, and also an illustration of considerable range of abilities that people displayed, and also an understanding, a sense that these abilities are not really adequately reflected in job descriptions. Respondents were very generous with their answers. They gave us loads of detail, which we're very, very grateful for. And it really demonstrates how much need there is for this. A lot of people mentioned the importance of on-the-job learning from experience, shadowing other people, mentorship support, and so on. Next slide, please, Polly. So these are some of the themes that we identified from the shared responses. These are the three questions, one in each column here. I'm not really going to spend time talking about this because we don't have time. Hopefully we're going to be able to publish around this, fingers crossed. But just to say, from the first column here, what you wish you had known, really kind of shared issues around the time required, time that didn't fit with the sort of time given, and also a sense of a low place of PPI and the PPI workforce in institutional priorities, sometimes seen as soft skills only, a frivolous pursuit, not serious like research. From the middle, the skills experience that have been useful, I just want to put a pin here, and I'll come back to that, on the communication skills. That's something that you'll see in the competency framework as well. So just put a pin on that. And then the training and knowledge that would help, as Polly said, we are hoping to sort of reach out and say, how can we develop, and this is the next stage of the project, different project actually, how can we develop training? And we've been working with Polly to develop some training and facilitation, but clearly there's much more need for that. Next slide, please. So in terms of the analysis, in terms of some of the important findings, I guess, I'd like to share with you now. First of all, again, where people came from. People came from a wide range of spaces, from journalism, from working in the voluntary sector, quite a large group, lived experience in health and care sector, a youth worker, and also from academia, some from industry, from academia, specifically mostly psychology degrees. So the breadth of experience is to be celebrated here. And what we need to make sure is that this framework doesn't provide an obstacle for people to come in to this space. So this is one of the bits of conversation that perhaps we'll have, so that we encourage and enrich the space rather than constrain it. Another thing I wanted to say is that there were loads of responses that are not only about training. So people talked about the organizational infrastructural issues that can't be fixed through experience or training alone, research timeframes, job precarity, institutional systems not fit for PPI purpose, and of course, one of the issues that comes up again and again is the problem with payment. Also, some of the training issues that people identified are not just about training. Remember, I said put a pin on communication skills. So communication skills is one, influencing is another. Yes, there is communication training, there is leadership training, there is assertiveness training that is very useful and important. But at the same time, we thought that people mentioning these needs is also about needing to have a voice, needing to have value, needing to have a closer link to the hierarchy in research institutions, and to have the voice heard. So finally, our colleague Alexandra Almeida in Oxford did a really good, excellent analysis of the data around how long staff had been working PPI, fraction roles that they have, and so on. We can't go into detail about these, but just wanted to highlight a couple of really interesting things. So those with a longer tenure, between 5 and 10 years in the role, found that were more positive. Some of the challenges identified had dropped off by that stage. And this is really interesting, an interesting finding, but also some challenges remained. And I'm sure if I ask you to guess, you would all say payment is one of them. But another interesting finding is that 18% of participants had no time allocation for PPI in the contracts, nearly a fifth of participants. That is a large number. Now, some of the participants, of course, were researchers or people working in communications or people working, having project management roles with a fraction of PPI, with PPI duties. So 20% almost did not have that acknowledged in their contract and in their hour allocation. And the other thing is that about half of those had been in the role for more than 10 years. I don't really know what exactly that tells us, but one of the things that it could possibly tell us is that over time, there is a better understanding that you need to allocate time to PPI, right? So the older contracts did not have PPI, PPI duties, people just did it anyway. More recent contracts tend to have it, but then why didn't the old contracts change? So there's lots of ambiguities, and I think there is something that comes up here, which is, again, the invisibility of PPI roles, the taken for granted of PPI roles. Next slide, please. Polly.
Thanks, Stan. So this is a very broad overview of the framework that we came up with. And we also looked at one that had been developed by Cancer Research UK a few years ago for their public involvement staff. And we developed this with Stan and with our colleagues, Claire Planner, Becky Morris and Sally Giles from the Manchester Centre for Primary Care, and also some public contributors. We had also done a shorter version of the survey that we sent out to the public contributors who attended that original difficult situations workshop, to ask them about the skills and the experience that they sort of got the impression they expected PPI staff to have. And there were, again, as Stan said, no surprises there. A lot of the same things came up. So it's worth saying that these 5 competency areas are very broad. There is definitely overlap between them. We split each category into 3 levels of developing, capable and proficient, and some of them we also suggested where there might be essential and desirable competencies. And again, I just wanted to reiterate what Stan said around the importance that we're really aware, and while we fully believe in the importance of standardizing PPI and these careers and recognizing it, we definitely don't want to do anything to take away from the ability for people to come into this from a huge range of backgrounds, and because of the richness that brings. So that's kind of where we are. As I said, there's a link to the full framework, hopefully in the chat, and you will have received that beforehand. In a minute, we're going to go into breakout rooms, and I've got some prompts for things to think about for that. But at this point, I just really wanted to take a moment to see if anybody has any questions at this stage, and perhaps it's helpful if I stop sharing for a minute. It's a lot of information in a short time, so there may not be questions at this stage, and if it's helpful to just hold on to those for the discussion, that's fine too.
Sorry, I have a question, but I don't know how to raise my hand. I was just looking for an option. So if you don't mind, I ask my question. When you mentioned about payment as a big issue, is it payment to the participant, or generally you mean the budget allocated for staff who are going to run PPI? It was not clear for me what you mean by payment.
It was the frustrations around payment systems and trying to pay public contributors, and just the fact that we are all still having these conversations and still having these issues years and years later. Yeah.
Thank you.
In that case, I'm going to suggest I will go back to sharing my screen again, and we've just got a little bit of information about the, if I can find it, there it is. Sorry, I'm not used to Zoom. There we go. Hopefully everyone, you can see that again. So we're going to go into breakout discussions now. We've left a good chunk of time because I think we've all been in sessions where you don't get long enough for chatter, but we've fitted in some time for a break at the end of this. So please do take 5 or 10 minutes at the end of the time just to take a moment, get away from the screen. Each group has already been allocated a note taker, and thank you so much again to those people who've agreed to take notes. Within your group, we'd ask if you could just also choose somebody else or volunteer yourself to be a light touch facilitator, so that the note taker doesn't have to do that as well. As I said, we've got some prompts for you as well, and hopefully you'll have lots to say and the discussion will flow, but just if somebody can be aware of keeping that on track. When we come back to the main session, we're going to ask each group to give 2 minutes feedback, and we are going to have quite a lot of groups to get through, so we'll have to be strict on that. But we thought maybe suggesting that you tell us about your top 3 points, including one challenge that you see from the framework, either in implementing it or that it might create, and one positive, anything else that you want to do. And that can either be the facilitator who gives that or the note taker, but again, if you just take a bit of time at the end to decide who's going to give the feedback. I should have said as well is that we've asked the note takers not to attribute comments to anybody, so please feel able to speak freely. You can use the chat as well, and we've asked that the note takers to save that and to remove any names when they send that over. Unfortunately, some of you will be in a group with me and Stan. What we would say is that please be honest, please feel able to speak freely. We're not going to be offended. We have put a lot of work into this, but we don't know everything. We don't have a good awareness of every job, every setting, and we really want to learn from this. We really want this to be useful and able to be implemented, and we can't do that without input from you. So I hope that you'll feel able to speak as freely as you need to. So these are just some questions to consider when you're talking. This is not prescriptive at all. Please feel free to, talk about other things that come to mind, but we just really like to get your general thoughts. Whether anything is missing from the framework, anything in there that you think shouldn't be there, how it might be put into practice in your setting, and whether indeed it could at all. What are potential barriers or unintended consequences that we might not have thought of, and are there ways that these could be addressed? And as I said, anything else at all that you want to tell us about. I hope that all is clear. Our note takers have got those questions as well, so don't worry about remembering all of them. We will come back. Nikki's going to do her technical magic, thank you very much, and then we will all come back having had a break and figured out who's going to give feedback at 11:40 to the main room to hear from our discussions. Might have to take it down to 1 minute feedback for each group. I'm really sorry that we haven't got more time, 1.5 minutes. So let's go to room 1.
I think that might have been our room. I'm not 100% sure.
Go for it, even if it's
if nobody else is claiming it, I'll jump in. Yeah, so we had quite a good discussion, to be fair, but I think the key things we were looking at was the framework's brilliant, but trying to find some, I guess, centrally accredited training or pathways, especially for the essential levels of the criteria, would be really useful. There wasn't a consensus on who that should be, where the money would come from, or how that would all be, but I think we were saying actually having a pathway would be really useful, and maybe being able to recommend resources that we've discovered and sort of saying these are great, but again, like having somebody to look at those and sort of sign them off to say, yeah, they meet a certain criteria would be really tough. But then one of the other things that was a really good discussion around was supporting around emotional disclosures and how to navigate your way through that in the moment, but then also kind of pick yourself up and your team up if you're dealing with that on quite a frequent basis. And saying actually that would be something that would be really, really helpful. There was more discussed, but they were probably the main points, I think.
Thank you so much, Martin. Thank you. That's really helpful. Group 2.
I think that might have been us. So we had a really in-depth discussion as well, and overall the feedback's really positive for the framework, and there's a real appetite to learn and to use this as a learning opportunity, whether that's via some kind of accreditation or using a standardization across all the different PPI roles across our different settings. One of the things that the group thought was missing though was something really explicit around research knowledge, talking about like research cycle, experience of publishing and the publishing cycle and things like that as well. So we feel like that needs to be brought out and be a bit clearer perhaps in the framework. And then within the EDI section, there was a point that said something like anti-racist, and we just wondered whether that needed to be a bit broader, or what the reasoning was really, that it just said anti-racist without any consideration for the whole kind of EDI piece. But like I say, overall the feedback was really positive. I think there was a really sort of lively discussion about that, and there's much more detailed notes to share with you. Hopefully that'll be more helpful.
Thank you so much, Rachel. Thank you. Really, really thoughtful. Thank you. Group 3.
I don't know which room I was actually.
I think we were group 5, room 5.
I think I was group 3 or 4, but I don't. Should we just keep going?
Keep the momentum moving.
So I agree. Like our group was very much in support of this framework and think it's a really great like progression step. We could also see how it would be used for developing job roles, but I think the main and like supporting staff in those job roles. But then I think like one of the main things that came out as a challenge was how would this be used across different organizations, and each organization is going to, like, maybe what you say is proficient is a different level in how they see PPIE. And then I guess it would be quite difficult to then try and say, oh, I'm actually at the expert level, but then each organization might say something slightly different, which could lead to challenges as well.
Thanks, Ashley. Really helpful. Yeah, all good thoughts. 4 or 5, Cassie.
Yeah, thanks, Polly. Yeah, so we had a really great discussion in our group. So thanks everyone for sharing. One of the kind of positives is that we really felt that this was needed, that everybody really valued it. We felt that it shines a light on a lot of the labour of our role that perhaps isn't recognised, and will be really helpful for everyone developing their careers, both in terms of kind of identifying where we are and where we'd like to be, and also kind of helping us to identify training needs and things like that. So massive thanks to you guys for putting this together. We identified that the flip side of that could be that if it was used, say, to determine a PPI job description, because there are some parts of it that we felt may not be essential, that could be trained, and we thought perhaps it could be viewed as some parts of it are more values and some parts are more kind of technical that could easily or could be more easily trained. So we wanted to make sure that the framework is adaptable, can be used flexibly in different organizations, and we also wanted to really make sure there's an emphasis on the soft skills that are required. And we had a suggestion to embed EDI throughout each of the other criteria rather than having it as a separate thing. Thanks.
Thanks, Cassie. Thank you. Loads in there. Brilliant. Group 6.
You've missed off 5.
I think it's 6, isn't it?
Sorry, I'm confused with Ashley and Cassie, where we're up to. Thanks.
Okay. Yeah. So I think our 3 key points are, firstly, that this ties in with the fact that about 80% of the PPI workforce are women. The fact that PPI is seen at the junior level, there's a lack of kudos, and there's a lack of understanding at a real high senior level in terms of appreciating PPI. So I think that's one of the key barriers we feel. In terms of things that might be missing, we could add is just tying in what somebody else has said in terms of research skills. So having experience of doing research ourselves, developing grants, being leads on grants, writing papers, that sort of thing. That's definitely missing, we feel. Linking in with what else is missing, having the community engagement side of things as well, their community engagement skills, because you need good engagement leads on to good involvement. Having lived experience as well, maybe that should be included in there, and furnishing with real world examples as well to illustrate those key points. And the other thing that's missing is having so real world examples, case studies to illustrate the different levels, the developing capability and proficient, and also linking that with recognised typical sort of job titles at universities, like, for instance, research assistant. So if you're at developing level, you're at the research assistant level, or you're a research fellow level, or a senior research fellow level, or etc., professor level. So you're actually giving it parity with research roles that are generally more well recognised in academic institutions. I think that'd be really helpful to bring that parity of esteem, because that's what we really need, I think, at the end of the day. So yeah, I think those are 3 key points: a barrier and a couple of things that could be added to the framework.
Brilliant. Thank you so much. Really helpful. Really helpful. Group 6.
I believe that's us. Yeah, we had some great conversations in the group, so thank you to everyone, and thanks to Sylvia for note taking. So our 3 key points were, firstly, a real need for resources to support the framework, and particularly if you're new to PPI, just where to go really to build on visibility and credibility of the role. The second was to potentially use the framework to reflect on all team members' skills, so not just one person expected to be proficient in absolutely everything. We know that PPI roles are quite multifaceted. but it will just help identify where the strengths are among team members. And finally, people really liked the framework, absolutely. We had lots of really good discussions, but there was a feeling that it would be quite hard to adopt it in settings, particularly within clinical trusts, which tend to focus upon patient safety and attribute banding in that way as well. So lots of love in the room for the framework, just a few sort of hesitancies about how that would work in practice within institutions. So thank you.
Oh, thank you, Amanda. Thank you very much. Up to 7, 8.
I'll butt in because I have no idea what. So sorry. Yeah, so overlap with many others. So positive point. People really appreciated it and said that it sort of responds to a real need, and they really appreciated the way it was put together, with a sort of had a practical aspect to it, and it wasn't sort of like yet another kind of academic attempt to create a job description, but it was kind of, it felt more grounded. So that was a positive thing. A sort of negative stroke unintended consequence is that some of the more junior developing skills are to do with facilitation and, you know, to do with relationships, and maybe that might continue the kind of understanding of something like that as quite simple and as something that, you know, people should know already, or to be allocated to junior roles, and how to sort of look into that a bit more. And in relation to that, the difficulty that this could be taken to make PPI more transactional. So again, this is an unintended consequence that for those institutions that tend to do that, that having this might actually help do this as well, and not kind of emphasize the relational aspects of PPI. And a final point, which someone else mentioned as well, is that, you know, the role is very much female gendered. And what does that mean in terms of its value, and how could we incorporate something in the framework to really sort of make it, the visibility more obvious and the value of it more obvious in what is essentially a patriarchal and, I would say, white institutional setup. So yeah, that's from us, I think.
Brilliant. Thanks, Stan. I feel like we've missed a group, but I know we were group 9, so I'm going to go to Anne, and then if anybody hasn't spoken at the end, we'll come back.
Hi everyone, we had a very nice discussion in our group. The points that came out, just put my clock on here, it's in the facilitation part, but relationship management seemed to be a key part of the job, both with the PPI members themselves, but also with the institution. And there's definitely discussion. The framework is very useful, but a lot of the issues that kind of bubbled up, managing boundaries with PPI members was an example, and is the framework trying to address this? So that was kind of putting that out there. Ethics came up, both ethics, understanding ethics. Does it overlap with PPI, and do we need knowledge in this area? This has come up in other groups too. Research ethics, but also the broader kind of ethical side of dealing with PPI members, what's expected of them, what they expect relative to staff, and is there some kind of grey area where it gets really confusing, you know, what we're expecting them to do? And that kind of resonates with group 2. I think Rachel was talking a bit about that kind of ethics area. So great though to have this. I mean, it's such a new area, relatively speaking. Sorry, that's just my timer. I'm over a minute, and really appreciate all the work, because this is a lot of work going into it. Thank you.
Thanks, Anne. Thank you for summing up for our group. That's fantastic. Group 10. Or any other group that I've missed, or that anyone, Sharon.
Hello, I wasn't quite sure whether our lovely note taker was speaking for us or whether we are, but I will dive in. Lots of points that people have raised already. There was thought about discussions about the emotional labour, which has been mentioned. Also thoughts about how this would be adapted for different settings. So some of our members were from the charity sector, and some of them weren't in the NHS or NIHR kind of context. So how could that be used? Recognition that one person can't necessarily hold all of these skills. So actually, is there a way of deferring or just showing people, look, this is everything that this role requires, but let's not say, oh, you're going to do the PPI bit and then kind of shirk our responsibility, because public involvement should be and could be owned and held by everybody in a research team. And therefore, these are all skills that we need. And is there a way of saying, yeah, okay, I'll take the lead, but these are also things that you need to know? And also a concern raised by somebody saying, well, what happens if somebody says, oh, well, you're not doing all of these competencies, so we're only going to put you at this band or this level in your role, is an unintended consequence, perhaps, and perhaps only used by people with a lack of understanding of what the role involves. I'm sure there were other things that I wanted to say and that people had said, but also a recognition that we need to help to make sure that everyone can find their way in. And people are doing PPI in so many different settings, particularly local authorities with the new health determinants research collaborations. They're coming in, one member of our group has been in the job for a month and she's just saying, I need everything. Send me everything. And some of this stuff only gets learned by time and by experience and by practice. So where does that come from? The last point is about supervision. And how many of us get supervision in our roles? How many of us get supported in that? Janet mentioned it earlier, that she goes to find a mental health nurse to talk to about stuff when it's particularly sticky. And that's not built into the role either. PPI is evolving as a role, as a competency, as a bunch of people. And so this comes at a very timely moment. And what do we do with it next? Thank you.
Fantastic. Thank you, Sharon. I hope everyone has given their feedback. Thank you all so much. Eleanor just posted a link somewhere in the chat. It might have got lost. We'd love your feedback on this session, some evaluation. We'd also really, if you were happy to be contacted by us in 6 months to see whether you've been able to implement this in any way or to gather any further thoughts, we'd be really grateful if you could drop us a line so that we can be in touch with you. But I'm just finally going to share my screen one last time so that Stan can do the last little wrap up on this.
Thanks, Polly, and thank you everyone for being with us today. So Polly has just said a few things about feedback, evaluation, and what we're doing, a lot of people asked what was happening next, is we're going to pick everything here, not just the points people raised at the end. We haven't taken notes. I haven't taken notes for this, but all the notes. So please send us all the notes and try to incorporate them. And also, please share resources. A lot of people on the chat have been talking about resources. Please share resources that could be mapped onto the framework. And please stay in touch with us, as Polly said, in 6 months to see if something has changed, if you've been able to implement it. People talked about a number of barriers. We will be in touch again and how we will develop this in the future. I mean, what's the follow-up? That's something that I think we do need to think about in light of today. Next slide, please. Really, I wanted to say a great big thank you to NIHR's Centre for Engagement Dissemination for funding this work and for all the support that Mirat has been giving us through these years, first Polly and her team, and then us more broadly. To the public contributors involved, Douglas Findlay, Moira Lyons and Georgina McMasters, and others who responded to the survey Polly, I think, sent out. Really grateful to the 82 people who responded to the survey so generously, and we really need to do something more with that feedback and all these detailed comments. Really give us a picture of the space. And to our colleagues at Oxford, Alexandra Almeida, Angeli Vade and Paula Ray, and also to Sally Jales, Becky Morris, Claire Planner, the team in Manchester for their work and encouragement. And thank you all so much for being with us today. And these are our emails for contact, and we'll be in touch. Thank you.
So that's it from us today. Thank you all for your time. Thanks for coming and for being so generous. We'll be in touch. And Mirat, I don't know if you need any final words. Thanks, Mirat and Nikki, for your help with the side of things.
just thank you and Stan for all the work on this. It's been great.
And look at that for timekeeping, 11:59. Thanks everyone.
Thanks everyone.
Thank you.
Have a lovely
Bye.
afternoon.